Hi, this is Dr. Matt, and today I'm going to be talking about blood pressure. Now, I'm going to go into a little bit of kind of the anatomy of it, but not too deeply. But I do want to discuss what people mostly do for it, which is to take medications. And really, most people don't even understand why they would take a medication. Obviously, they do it to lower a number, right? So what that's doing is it's lowering a blood marker. But in all reality, when we look at blood pressure, there are three main components that make it up, and that are these three things over here. We have heart rate, stroke volume, and peripheral resistance. So really, kind of the definition of blood pressure is a fixed volume of blood at a certain pressure that's moving through a closed system. So if you affect that system in one of these three areas, you're going to change blood pressure. I guess the bigger concept of all this is to understand that if you raise any one of these three things, blood pressure is going to go up. So we look at heart rate, right? The faster the heart beats, the higher the blood pressure. The more the stroke volume, which what that is every time your heart contracts, it pushes out a certain amount of blood. So the higher or the more forceful it's pushing that blood out is also going to increase the pressure. And the last one is the vessels, right? Or what we call peripheral resistance. So that is, we're looking at the artery, and many people have heard of something like atherosclerosis, or called plaquing in the arteries. So if your artery is full of plaque and it's a smaller tube or a smaller pipe, then the pressure is going to be increased to get that blood through the pipe. So again, these are the main things that create an increase in blood pressure. So looking at all this, we want to know, why is someone's blood pressure high? Is it because there's too much blood volume? Like we said, a fixed volume of blood at a certain pressure. So if there's too much blood volume, what is often given is a diuretic. What we worry about with the diuretic is that that can actually cause an increase in the contraction of the heart, which is going to lead to an increased volume of blood, again, increased blood pressure. The other thing is, are we looking at what's moving the blood through the system? Is that pumping too hard? Or are the arteries too small and rigid, or are they full of plaquing and atherosclerosis? So, looking at all these, sometimes we can look at environmental factors. What can you do to decrease that on a more natural basis? Are you eating well? Are you exercising? Are you smoking? Do you have too much stress? So these are all factors you might look at first to control, to see if any of those are affecting the blood pressure or raising it, as opposed to just right away going to the meds. One last thought I wanted to leave with all this is increased heart rate is really a response to the physiology or normal physiology of the body, and that physiology is responding to both internal and external stimuli. So again, I'm not saying take medicine, don't take medicine. I just want you to think about this, like, okay, what might be happening, where is it happening, and where can we affect that? Thanks for listening. We'll see you next week.